Hello, everyone, and thank you for joining us for another webinar in ICFJ's Global Health Crisis Reporting Forum. A little background here as people start joining us on our webinar. ICFJ has been running these webinars for a little over a week now. They are for members of our Global Health Crisis Reporting Forum, which is a Facebook forum. If you're not a member of that forum, we encourage you to go to Facebook, go to the Global Health Crisis Reporting Forum and sign up. We have about 1,800 members of the forum right now, and we expect that number to grow considerably. These kinds of webinars are one of the things that we're offering there. We also offer many resources for journalists covering the crisis, everything from medical information to terminology to ethics of reporting on the crisis. And these webinars, doing almost one a day now in English and Spanish. So we encourage you to check out the offerings that we have for the next week or so. Well, today we're going to be talking about an important issue, which is how COVID-19, the pandemic, is affecting the issue of migration and migrant populations. We are going to talk with two experts today from the Migration Policy Institute, and they have different areas of expertise. So we're going to be talking about a number of issues in terms of how the pandemic is affecting migrants. One of the things that we sometimes hear about this pandemic is that it doesn't discriminate, that it can equally infect a Wall Street banker or a homeless person. And that is sort of true, but in fact, certainly some populations are more vulnerable to being infected because of where they work or live, and people do not have the same access to treatments in our country, in the United States, and in countries around the world. So those are some of the issues that we're going to be tackling today. And now I'd like to introduce our two panelists from the Migration Policy Institute. Sarah Pierce is a policy analyst for the U.S. Immigration Policy Program at MPI, and her research expertise includes U.S. legal immigration processes and actors, the employment-based immigration system, and unaccompanied child migrants. And Natalia Banulescu-Bogdan is Associate Director of MPI's International Program and a non-resident fellow with MPI Europe. Her areas of expertise include social cohesion and identity, values and civic engagement, and the intersection of nationalism and migration. And I'd like to remind everyone that we've already conducted one webinar on migration issues. That one was in Spanish, and we did that with the president of the Migration Policy Institute. You can find a recording of that webinar and a summary of the main points at ICFJ's website, icfj.org. You can also find recordings of all of the webinars that we've conducted and summaries of the main points from those webinars. So encourage you to check out all of the webinars that we've held so far. I'm also going to encourage you who are listening to send us your questions for Sarah and Natalia. And you can do that in the Zoom chat. One of my colleagues, Stella Roque, will be passing those questions to me. And you can also do it in Facebook on the forum. So we encourage you to send us some questions. We've already gotten some, and I'll be asking those questions of Sarah and Natalia. So Sarah and Natalia, thank you so much for being with us. And to start, I'd like to ask each of you to tell us what is your biggest concern about how the pandemic is affecting migrant communities. Sarah, do you want to start?
Sure. And just to start, thank you so much for having me, and thank you all for the work you do at a time where I think clarity you provide has never been more important. So I think that for me, the biggest concern right now are the ways that policies are affecting immigrants internally, immigrants who are already in the United States. But just to start very briefly, I want to go over the thing that's gotten more attention is the way immigration has been used as a tool to fight this crisis. And in the United States, we've seen that in two respects. First, travel bans, and then unprecedented border closures. The travel bans were the first thing this administration turned to fight against the virus. And they did so very quickly. So on January 31st, President Trump issued a travel ban on any foreign nationals coming from China. This is not a ban on any Chinese nationals, but rather any foreign nationals who had been in China within the last 2 weeks. Then the administration added to that rather quickly Iran, the Schengen area of Europe, United Kingdom, and Ireland. It's a really comprehensive ban that applies at the visa processing stage, pre-flight screening, and at the border. But what is unfortunately rather characteristic of this administration, it had a very hurried execution, which really led to, at least in the United States, a lot of people waiting for a very long time in crowded lines, which is exactly what you don't want when you're fighting against a virus. The other tool they've used are these unprecedented land border closures. They used two legal structures to do this, both of which are decades old and to our knowledge have never been used before in this respect. The first is a CBP rule, a Customs and Border Protection rule that suspends entry for anyone that isn't deemed essential traffic, which is really mostly just suspending tourist travel. And this was actually negotiated ahead of time with Canada and Mexico and applies to both borders. The other one is a CDC order, so coming from the Center for Disease Control and Prevention, which declares any unauthorized immigrants to be public health threats and as such blocks their entry to the United States. What this does is essentially accomplish something that the administration has been working for nearly 2 years, which is block asylum seekers from entering the United States. Anyone who doesn't have documentation to enter the United States, who tries to enter a port of entry, or who's caught trying to enter in between ports of entry, is either being turned around to Mexico. As far as the reporting goes, it sounds like Mexicans and Central Americans are being pushed back to Mexico. Anyone else is quickly being taken to an airfield to be sent back home.
Okay.
So that's what has gotten a lot of attention as far as immigration being used as a tool. But I think what's more concerning are the policies that are affecting immigrants already in the United States, and that response has been woefully uneven. The agencies that do processing of visa applications or work authorization have extremely pared back their services, while the agencies that do immigration enforcement have continued nearly business as usual. There was an announcement by ICE, our internal immigration enforcement agency, that they were paring back their enforcement and detention efforts to just individuals who have serious criminal convictions or are public safety threats. But that statement was undercut by statements from senior leadership within DHS. And also, since they made that statement, the population in ICE detention has actually grown, and over 60% of them don't have criminal convictions. So there's a lot that's undercutting those statements. So as a result, in the United States, we have a population of 11 million unauthorized immigrants that are already very uncomfortable. And then we have several million more non-immigrants and individuals with work authorizations that don't have an ability to renew those and are really just watching the clock as those run out and fearing that they're going to fall into the hands of immigration enforcement as a result. This, unfortunately, is layered on top of vulnerabilities already inherent to immigrants. Immigrants have less access to safety net benefits. They're more likely to lack health insurance coverage, and they have lower median incomes than the US born. They're also being left out of pandemic specific benefits. So the bill that passed on Friday, the medical provisions are limited to green card holders who have had their green cards for 5 years at least. And the recovery rebate that everyone's been talking about, it leaves out anyone who files their taxes using ITINs rather than social security numbers. So that leaves out luckily more than 4 million immigrants.
Okay.
In addition, immigrants are also disproportionately represented in some of the critical occupations on the frontline war of this pandemic. So healthcare, elder care, food services, delivery, and day-to-day care. So what we have right now are a set of policies that are either intentionally or inadvertently hurting immigrants. And this is a population, like I said, that's disproportionately on the front lines of this pandemic. And as a result, we're really compromising the well-being of us all.
Okay, we're going to get back to some of those specific issues in just a sec. Natalia, you have a more global perspective on this. Can you tell us a little bit about what's concerning you most?
Sure. So similar to what Sarah was talking about in the United States, we've watched an extraordinary acceleration all around the world at this point of countries using migration management tools, first to try to contain the virus, and then when that failed, to halt its spread. And so, in early March, we started to see a handful of countries issue travel bans, restricting nationals from China and Iran from coming, for example. But as of a week ago, IOM estimates that 174 countries have implemented COVID-19 related restrictions on mobility. And some of these include closing borders entirely or imposing total bans on passengers. And so I think as we look at this sort of race to insulate ourselves from this threat, I would just point to two kind of blind spots or mistakes that I think were made. The first one is that many of these measures were really a piecemeal approach. And it's worth remembering that the border is only one part of the puzzle, and in some cases, a distraction. So first, it's impossible to hermetically seal borders in the world we live in today. Borders are porous. Closing legal routes does not mean you are stopping all entry. Also, the restrictions that were being implemented in the early stages of these bans, and even still today, are riddled with exceptions and loopholes. And so these two things taken together means that a steady stream of travelers from outbreak areas were still getting through. And these people were either not being screened or being screened quite haphazardly. So, you could say that this was sort of one of the loopholes exploited by a virus that doesn't care what passport you hold. And I think, again, one of the issues was not thinking about how travel restrictions need to work in concert with other interventions. So what's the point of all of these strenuous efforts to make sure that a disease doesn't cross a border, but then for weeks doing nothing to track the flow of people who are still entering, which was a sizable flow in all of these cases, especially as we know that it can be spread by people who are asymptomatic. And I think one of the things that this illustrated was there's a real temptation to use the tools that we have and the tools that we know how to use, like visa restrictions, even if these tools are not actually well suited to the challenge. So in a case like this, restricting entry based on nationality is going to have a very limited effect. Things that are likely to be more effective, like contact tracing, widespread surveillance, these are things that we're more uncomfortable with, especially in countries with very strong feelings around data privacy. And the second blind spot, just echoing what Sarah has said about needing to pay more attention to what's happening within our borders, is once community transmission has already started, we need to pay attention to these deep pockets of vulnerability within our own countries. So one of the most important assets, maybe the only asset we have in a public health crisis, is people's willingness to come forward and openly disclose their symptoms, which they will not do if they fear legal or financial repercussions, effects on their livelihood. And so, I think right now, the biggest challenge I see is we need to figure out how to reach these communities of vulnerable people who have weak trust in public authorities, who have limited access to healthcare, including, as Sarah said, the unauthorized in the United States, Roma encampments in Europe, migrant workers on precarious contracts in the Gulf states, and particularly populations in detention or camps.
Yeah, and I do want to get to that issue too in just a moment. Sarah, you talked about how the Trump administration is using this crisis to put into place policies that it really probably wanted for a long time. Do you have any fear, or are you concerned that once those policies are in place, they will stay in place even after the crisis is over?
Yeah, absolutely. It's hard to picture the administration rolling back policies that accomplish something that it's been working for so long. I think there's a lot of legal insecurity with these policies that, especially, those related to asylum seekers, they stand in direct contravention of federal and international laws. So I think in the end, what will likely happen is it will be the court system that will decide when these policies should be rolled back. It's hard to picture this administration rolling them back, though.
We also heard just a couple of days ago that 3 unaccompanied minor children tested positive for COVID-19 while in custody of a U.S. refugee agency in New York. What are the conditions like in, I don't know if they were in a detention center, but what are the conditions like in the centers where immigrants are being held? Do you expect that we're going to see a large spread of the disease in those centers? And what should the U.S. be doing to limit that?
Yeah, so unaccompanied child migrants are housed by Health and Human Services, where immigrants are housed by ICE. So their facilities are a little bit different, but I think in any sort of detention center, there's a huge risk of outbreak because you have a lot of people living in very close quarters. There's a lot of human contact, and then the access to health services is very limited. And at least when it comes to ICE detention, we've already seen outbreaks. We've seen outbreaks of measles, mumps, the flu, and chickenpox. So there's a huge amount of concern about that. And it's extremely concerning that there's no evidence that at least in the case of ICE, but also with Health and Human Services, that they've been trying to decrease their detained population in order to prepare for these outbreaks.
And Natalia, following on what Sarah said about the Trump administration perhaps using the crisis or putting into place policies that it would have liked anywhere, are you seeing that in other parts of the world in terms of limitations on immigration being put into place that perhaps leaders of those countries would have liked to have seen anyway?
Yeah, I mean, we've seen it in terms of policies being implemented and also, at the level of rhetoric being used. So, many populist and far-right politicians were very quick to make the link between foreigners and disease right at the beginning of the crisis, despite the fact that, that link has never been supported by any evidence. As we've talked about, this virus is sort of an equal opportunity employer. And the World Health Organization has long said that in cases of pandemics, these things are more likely to be spread by casual travelers, so returning citizens, business travelers, health workers. But restrictions on migrants and asylum seekers definitely were, some of the first moves out of the gate. Countries like Hungary and Greece trying to, project a sense of control to their publics, but also potentially, wanting to find an excuse for draconian immigration restrictions that they couldn't achieve by other means. So those 2 countries banned asylum seekers for 1 month. You saw, Italian politicians blaming the devastating spread in Italy on boats of African migrants arriving on Italian shores. Again, with little evidence that would have been one of the vectors for the spread. And I think, the Greek case is particularly worrisome because the government there really has leveraged fears about the spread of the virus to justify a very controversial plan to essentially build closed camps or detention centers for asylum seekers who do reach Greek shores. And there's some evidence that others are just simply being, boats are simply being pushed back in contravention to international humanitarian law. And just to also add to the point you were asking Sarah about a minute ago, I think even if administrations change and populist politicians are out of office in a couple of years in some of these places, and the far right loses some power, it's going to be very difficult all over the world to walk back some of these restrictions because no leader is going to want to be the person responsible for opening borders and having, you know, some kind of national security threat being blamed on that opening. So I think, you know, once these things are in place, once this hardening has already taken place, it's going to be very difficult to walk back.
Yeah. And you talked about closing borders being, you know, something that a lot of governments are doing. Can that be an effective strategy to limit the spread of the disease, or perhaps if done in conjunction with other methods? You can understand why people would feel like closing the borders would work. Is it an effective strategy?
Yeah, it's a great question. I mean, I think my answer is yes and no. And the key, as you said, is these things being used in conjunction with other strategies. So travel restrictions are certainly a key part of reducing movements of all kinds and limiting the human interaction that this virus needs to survive. But I think the disproportionate focus on the border created the impression that we could somehow wall ourselves off from this disease. And we can't. So there are three issues there. So one, as I said before, borders are inherently porous, and people are always going to try to circumvent barriers if you put them there. So motivated travelers will be willing to take, you know, big risks, including, you know, circumventing controls, but masking their symptoms at ports of entry. Or, you know, in some situations, we saw people engaging in more circuitous travel to get around some of these restrictions, which, you know, all of these things, of course, have adverse effects on public health goals. And then, you know, as I alluded to earlier, you know, even the strictest border closures have exceptions for certain groups, returning citizens and their families, diplomats, air and sea crew members. And so we were treating these groups of travelers as a lower category of threat because of our kind of muscle memory about national security and terrorism, you know, other kinds of threats, where known and trusted travelers are considered a lesser threat. But this isn't true of communicable disease. We've seen that a lot of community transmission has been linked to returning nationals, and these groups, you know, have kind of gone through a back door of screening in some cases. So related to this, you know, nationality is not a good proxy for threat. So, you know, we saw some kind of, you know, strange things being implemented where, you know, Hungary putting a stop to Iranian asylum seekers, but actually ended up preventing some people from coming in who hadn't been to Iran in years, had been in closed, you know, detention centers in Turkey. So stopping people who hadn't been near an outbreak area, but on the other hand, missing other people who had. And so, you know, I think it's fair to say that the kind of mobility being curtailed was not always the kind associated with the greatest threat in spreading disease. These bans also are extremely costly, and I think that's another reason why the World Health Organization, which obviously takes public health very seriously, cautions against using blanket bans, because closing down borders shuts down everything. It shuts down cooperation between countries. It makes it difficult for more difficult for health workers and needed medical supplies to circulate. So that all said, you know, I think it's important to remember that travel restrictions can give you a head start. So we can't insulate ourselves from the virus, but we can buy ourselves some time. But here I would just underscore that, you know, if you buy this time at, again, enormous costs, you have to actually use it. So you can't then, you know, turn a blind eye to what's happening inside the country. And I think, you know, in the United States and in other places, the failure to act aggressively to trace and track outbreaks within, yes, and the, you know, the testing, you know, meant that the failure to sort of act on the other side of the system really undermined any efforts we were making at the external border.
Great. Well, not great, but good point there. So I'm starting to see some questions coming in from those who are attending the forum, the webinar, so that's great. I'm going to give you a question that came in earlier from a member of our Global Health Crisis Reporting Forum. Disha Shetty asks about the lockdown in India and how it is affecting internal migrants there. And then I guess the bigger question is, how should governments weigh the goal of preventing the spread of COVID-19 with the effects of these lockdowns on the poorest members of society? I guess, Natalia, that's probably a question for you.
Sorry, just unmuting myself.
Okay.
Right. So, I think what we're seeing is all around the world, those who are already in very vulnerable conditions are experiencing kind of exponential increases in vulnerability because of this crisis. And I think those whose mobility is constrained, so whether, again, populations in camps or camp-like settings, or internal migrants who are sort of trapped, once these restrictions go into force, are sort of facing acute risks. And the issue is that we, you mentioned trade-offs. I mean, we have to make all sorts of decisions, similar to, what Sarah was saying about enforcement, about, whether to pursue certain goals in our society at the expense potentially of other goals. And I think when you're dealing with, public health, where again, it is important for everybody to have access to basic hygiene, to have access to physical distancing measures. It will entail sort of relaxing some other restrictions. And enforcement is an important goal in our societies. It has legitimate aims, but we have to understand that these things will come at a cost, and governments simply have to weigh those costs. So I think again with internal migrants, we're just seeing a sort of trifecta of vulnerability of people who in one fell swoop lost employment opportunities, lost housing, and were didn't have the opportunity to access safe passage back home. And so, again, thinking about trade-offs, governments have reasons to restrict mobility, but you can't always think about things in an ideal way. Ideally, everybody would stay at home and stop spreading disease, while in reality, those of us in society who have the least recourse to resources, to networks, people are going to be pursuing workarounds that are, that again are not necessarily going to be fulfilling public health goals.
Yeah, we all saw those images from India, video and still photos of people thronging the buses trying to get on, and obviously that is not a good way to keep the disease from spreading, and people are all bunched together trying to get on a bus. So one more question for Sarah, and then we're going to look at some questions that we're getting from the audience. If you're joining us late, my name is Patrick Butler. I'm the Vice President of Content and Community at ICFJ, and we're talking with two experts from the Migration Policy Institute about issues affecting migration. So Sarah, a question for you. It kind of gets to what you were talking about earlier, about immigrants often being sort of in the occupations that are most likely to be dealing with the public, who cannot stay home and work from home, who really if they're going to keep their jobs, they have to be out there. Healthcare, food services, delivery, all of those kinds of things. And you talked a little bit about what isn't available to immigrants. What would you like to see the United States doing to help those people? And a second question, is that Is there evidence that those people are more likely to contract coronavirus and diseases like that? Or is it just sort of common sense?
Sure. I'm going to start with the second part first. I think immigrants are more likely to be in a position that makes them vulnerable to the virus. First, because they may not be able to afford to social distance. They may not have jobs that allow them to work from home, and they can't afford to miss a day's work. Also, many immigrants are in the front lines of this fight against the virus. Our colleague Julia Gillette published a brief on Friday that I highly recommend, that goes through the major occupations that are vital to the fight against this pandemic, including healthcare, food services, delivery, et cetera, and shows that immigrants are disproportionately represented in these occupations. Just looking at physicians, 30% or 29% rather of physicians are foreign born. So immigrants are in these positions that are extremely vulnerable to contracting the virus. And then as far as what the government should be doing to support them, well, first, what I spoke about earlier is that the immigration response in the United States has been uneven. We are continuing enforcement operations while failing to allow immigrants to renew their visas, renew their work authorizations. Those services that our U.S. Immigration Agency usually has in place have been contracted and pared back. So USCIS needs to do some things to allow those visas to either be automatically extended, same with work authorizations, or offer something to allow people to renew their status and stay legally and not fear the threat of immigration enforcement, which is happening right now. We also need to make sure that public benefits are available to immigrants. Some of the most vital benefits in the package that passed on Friday, but even benefits before that were not available to immigrants. And one unfortunate irony of this virus is it is happening at a time where U.S. Immigration Agency is implementing a rule that we expect to chill millions of immigrants and their families from accessing public benefits and healthcare. It's called the public charge rule. It's unfortunately extremely complicated, but what it does is deny immigration benefits, specifically green cards, but some others as well, to individuals that have used public benefits, certain public benefits, or who the government deems are likely to use. And even though it does allow immigrants to still access, some important services such as community health centers and hospitals, it's such a complicated rule that there's so much confusion around it. So it'd be great if USCIS would also suspend that rule, or at least provide some very clear clarity on it, just so we make sure that these very vulnerable populations to contracting this virus are also still comfortable coming forward and receiving, vital health benefits at this time.
Okay, we're getting some really good questions from our audience. A couple questions around advocacy. John K. Bingham has a question in which he cites some of the statistics that, Sarah, you're kind of talking about here about immigrants being on the front lines. That IOM, the International Office on Migration, says that of the 6 million migrants working, that just in the US, 6 million migrants are working on the front lines, 1 in 3 of all physicians, 4 in 10 of all home health aides, and large proportions of cleaners in hospitals, workers producing food, and staffing at the businesses that transport and sell it. Very good point, as you've been saying. And I think what John's question is about how we can use those statistics in a sort of advocacy way to show, in this case, Americans, that immigrants are contributing so much more than they may be thinking. Have you thought and talked about that at Migration Policy Institute?
So we are a nonpartisan think tank. We don't engage in a lot of advocacy, but I definitely think and hope that this creates a conversation about how we allow different immigrants to come into the United States. I was an immigration attorney before working at MPI, and a lot of my clients were doctors, and our laws are built in such a way that it makes it extremely difficult for doctors to immigrate to the United States. Even US trained foreign-born doctors, it's actually more difficult in some cases for them to get green cards or even H-1B visas, a very common work visa. So I do hope this opens up a conversation about how we allow these populations to immigrate to the United States and what their opportunities are. And I think there's a big appetite for that, but I don't think we've reached that second step of actually advocating for change just yet, as we're all, dealing with this pandemic as it comes.
Sure. And a question from Thomas Wiraria, I hope I'm pronouncing your name right, who thanks you both for the greatly enlightening insights. And he's asking, I think, a really good question about how information on COVID-19 can reach migrant people and homeless people, many of whom have little access to the sources of information that we rely on, newspapers, television, even radio, social media. Any thoughts on how we can make sure that people who are most vulnerable are getting the information they need?
Do you want me to jump in on that one?
Why don't you take that one?
Okay. It's sort of ironic that at a time where we have more information available at our fingertips than ever before, we also face such constraints on the flow of high quality information to the people most in need of it. So there are, a couple of different issues here. One, the populations who are extremely vulnerable that we discussed earlier, those whose mobility is constrained, who are now trapped in, camps or camp-like settings. The flow of information to these people is more restricted than it even was before. You have restrictions on humanitarian workers and aid workers being able to enter these facilities. You, of course, have completely unequal access to broadband and, things like smartphones. And so, there is a restriction on the flow of high quality and trustworthy information at the same time that you might have fear and mistrust within these communities vis-a-vis public authorities, and at the same time that you might have spurious information, flowing through other channels that isn't necessarily trustworthy. So I think for advocates, humanitarian workers, anybody working with immigrant communities, I think it's going to be a really big challenge to make sure that people have access to high quality information, but then also are able to surmount these real trust barriers that have been erected. And as Sarah's talking about how it would be helpful to loosen some of these enforcement efforts in an effort to promote good practice and public health and enabling people to come forward. I just can't help think that some of the grooves that have been created in terms of people being mistrustful of what the government says or has offered or has promised are going to be really difficult to smooth over.
Yeah, and we talked about detention centers in the United States. Obviously, refugee centers in countries like Kenya and Jordan and Pakistan are even more likely to be hotbeds of the spread of the disease, where people are really in close confines. It's very difficult for them to practice social isolation, and of course, services are questionable there already. What should the international community be doing to help these refugee camps where we know we're going to see just a huge spread of cases?
I think there's been a lot of advocacy activity already. Humanitarian organizations are extremely concerned about conditions in camps. Again, there are two basic things we're being told by public health authorities that are our main weapons in fighting this disease, and those are hand washing and physical distance. And these are things that we know are not available to people who are in closed centers. So I think there's been, there have been a lot of great efforts to persuade governments to increase supplies to these people, to not hold people in overcrowded situations. The situation on the Greek island where you have centers set up for a couple thousand people that have 30 and 40,000 people. And there's a fear of contagion of the disease spreading to the mainland, and so the mobility is being further and further restricted. But I think the thing that we're all underscoring is that we're only as strong as our most vulnerable groups, and there's no way to build a wall around these communities such that we insulate ourselves from the threat if we do not provide the most basic resources to help the very vulnerable fight this.
Yeah. One interesting question from Pietro Romano, who is pointing out that there are actually a few positive examples out there, and he mentions Portugal, where asylum seekers who have residency applications underway were granted citizenship rights so that they can have access to Social Security and healthcare. Are you familiar with that example? Are there other good examples we're seeing around the world?
I think that is a great example. And again, it's, what we're talking about in terms of making efforts to temporarily halt enforcement or create a pathway to secure legal status for people who are otherwise living in the shadows. So I think it's great when you see efforts like that. But again, I think we have to think about sometimes the gap between what is created on paper and what people perceive is safe and secure in reality. And, in places where there's a long history of mistrust between immigrant populations and government authorities, even a temporary halt on enforcement is only going to be part of the solution.
Okay, great. And we have a number of questions about what's going on in India. One from James Woolley, who talked about migrant workers in India being forced to squat on the roadside and sprayed with disinfectant, which turned out to be bleach. And that he's asking about the sort of panic that we're seeing around this. And how do we control that kind of panic that is leading governments and others to take these kinds of really extreme measures?
Well, I don't have the answer for how we can control this. It's certainly very unsettling what we're seeing in large parts of the world, and this has a very long history. When we are experiencing these kinds of upheavals in society, massive social upheavals or economic distress, or some kind of insecurity related to national security concern. When we're faced with these big threats that are amorphous or invisible or sort of too big for us to wrap our minds around, one of the first things that happens is finding something you can control and finding something that you can see in society that you can point to as a problem. And often that thing is immigrants. So, there's a long history of connecting foreigners with outbreaks of disease. There's a long history of scapegoating immigrants for other problems that we see in society to which they may or may not be connected. And, I think that while there are positive stories and the ones we've just, highlighted, and so many examples of immigrants at the front line of fighting this disease and being part of the solution, we're also seeing a huge backlash as people are eager to point a finger at something they can see and potentially control.
Yeah. A question from Sherry Riccardi, who is a trainer working with ICFJ on programs around the world. And I'll add my first part of it myself, which is, how do you assess the coverage that you're seeing in the media of how migrants are being affected by this? And then her question, which is, what is your best advice to media organizations covering these policies and the developments affecting migration during the pandemic? Sarah, do you want to start?
Sure. So at least as applies to the United States, I think there's been a lot of really great coverage about the ways migration has been used as a tool to try and prevent the COVID-19 from entering the United States. But I've seen a lot less coverage about those issues that I was saying concern me more, which is the disproportionate reaction and use of policies inside the United States that affect immigrants and the very uncomfortable position immigrants are being put in the United States. I'd love to see more coverage on that. And as far as advice for covering these policies, I have to plug that Natalia and I are always a resource available to the media. And we have a whole host of experts that we work with and part of our job is really to help you all do your vital work. So please feel free to reach out to us when you have questions about how policies are working or just, trying to interpret changes that are going on.
That's a good point. And we will be putting, with your permission, contact information on the forum so that people can get in touch with you for further questions. Natalia, thoughts on the coverage that you're seeing or advice to media around the world?
I think, I think just agreeing with the points that Sarah made, and then, I think, to the extent that we can also, get some perspectives into the debate that, again, might be kind of more closed off from the world and from information as it's being circulated right now, that would also be a very good thing.
Okay. And, this is a very good question from Nazmul in Bangladesh. As countries have closed or restricted border because of the coronavirus, what is the probability of increase in human trafficking? Do you see any impact of the virus on that issue of migration?
That's a good question, and that's something that I don't think anybody has any evidence on right now. Human trafficking and smuggling, is something that, well, I'd like to treat those things separately and just speak more of the use of smugglers, where there's there can be a kind of transactional relationship between would-be migrants who are in very desperate circumstances and are trying to circumvent barriers to movement, including border closures and enhanced controls, who might, enter relationships with unscrupulous characters that they might not otherwise have had a need for. So, I think every time you do see border closures in general, you do see an increased reliance on other methods to try to circumvent these controls. And, smuggling services run a gamut and can be, as I said, sort of transactional, but can also turn into involuntary arrangements, can turn into more human trafficking-like arrangements where people are in very vulnerable circumstances and no longer have the ability to sort of exit these arrangements. And so, I think it's certainly possible that with all of these border restrictions, we might see more of a reliance on smugglers.
Mm-hmm. And what about trafficking? You said that was kind of a separate issue.
Right. I mean, we do less work on those issues, and it's also, an area where there's unfortunately very little good data just because of the nature of this being underground. Yeah.
Okay, so that's something that needs a lot more investigation. A question for both of you. In addition to this health crisis, obviously we're also going through an economic crisis, and we've hit on that as we talk about vulnerable populations. But I think when there are global economic crises, that tends to affect migration as well, as people move in search of some kind of way to support themselves and their families. Long term, what kinds of changes do you expect to see in migration patterns as a result of this? Sarah, do you want to start, and then Natalia more globally?
When it comes to the United States, we actually expect to see a decrease of migration to the United States. Pulling from the Great Recession as an example, we had a huge decline in unauthorized arrivals at the southern border. I would expect a similar decline, except that the population that was arriving at the southern border before the Great Recession were largely economic migrants. They were single adults who are coming to the United States to work. Since the Great Recession, the increase in the unauthorized arrivals at the southern border have been much more humanitarian based. They've been families and children coming from Central America. They've definitely been inspired by the strong US economy and job market, but that wasn't the only reason pushing them. So I do think we're going to continue to see unauthorized arrivals, but we'll definitely have a decrease with the strength of the economy. And for other immigrants, I think temporary workers will definitely decrease. We saw a decrease in H-1B workers, for example, during the Great Recession. But green card holders never really dipped because US laws are so restrictive on the number of green cards we grant each year. I think they'll probably continue to be around 1 million each year.
Okay. Natalia, any thoughts on global trends?
Yeah, well, I mean, as we've discussed, this crisis is really going to exacerbate existing inequalities all over the world. And in some ways, that's going to constrain mobility. So, you know, if we're talking about movements out of the developing world, you know, it's important to understand that it's not usually the poorest and most destitute who cross international borders. Migration requires resources, both in terms of financial resources, but also having the networks and opportunities abroad. So we might see a larger population of people whose mobility is constrained because of this. And then, you know, as Sarah was saying, as we see the full effects of this next global recession, we're going to see a sort of restructuring of global labor markets. And some industries might adapt, might make, you know, the temporary changes that we're seeing now more or less permanent in terms of conducting business while maintaining physical distance. So that might point to a much greater use of technology, artificial intelligence, you know, robots, you know, at a time where we're basically, as Sarah was saying, you know, preventing seasonal agricultural workers from entering the United States. You know, we might see companies have to innovate through the use of, you know, mechanical picking mechanisms, and those types of innovations could become permanent. And, you know, part of what we saw after the Great Recession was lower income workers getting left behind. So again, I think we'll probably see, you know, some of these patterns again, and a larger restructuring of the labor market in general.
Okay. Have a couple of related questions from two related questions. One from Victoria Elliott, who's asking both of you actually about whether migrants are more vulnerable to misinformation and disinformation around the pandemic. And I would add another follow-up to that, which is, are non-migrants also more vulnerable to disinformation about migrant communities, which relates to a question from Alok Gupta about rising racism being triggered because of COVID-19 and whether that would have any impact. I think we've kind of touched on that a little bit. But let's talk about the disinformation part of it and whether we're going to see disinformation reaching migrant communities, but also disinformation about migrants to broader communities.
Yeah, absolutely. I think that's a huge issue. Just looking at the United States, we have big language barriers for our immigrant communities and just cultural barriers as well. There's a lack of familiarity with US institutions, and that tends to breed disinformation, and it also creates fertile ground for anyone wanting to take advantage of that lack of familiarity. So that's a huge issue. And with respects to rising racism, we already had an administration in place that views immigration, both legal and illegal immigration, very negatively. From his campaign, presidential campaign, President Trump has always characterized immigration as a threat to U.S. security and to the economy. So having this crisis, public health crisis, and now an economic crisis, I think there's a real risk that that's just going to piggyback on the suspicions that we're already breeding relating to immigrants in the United States.
Okay. Natalia, do you want to add anything to that?
Sure. I mean, I think everybody is vulnerable to misinformation and disinformation. I mean, I think there are a couple different issues here. So one is people who lack access to information channels, and especially high quality information channels. But then, you know, on the other side of that, there is this proliferation of information with, you know, social media, with different media outlets, with, you know, word of mouth, and we're in this environment where people can basically pick and choose what information is most convenient to them, and that really aligns with how humans want to consume information to begin with. So it sort of reinforces this bias that we already have within ourselves to seek out information that that basically reinforces our pre-existing beliefs, affirms our sense of identity. And so, you know, that's why you have a lot of this polarization with people basically, even if they're exposed to different kinds of information, will gravitate toward the information that just confirms what they wanted to believe anyway. And so that's why it's quite difficult to fight some of the stigma and stereotypes that are being circulated about immigrants. Again, you know, being painted as vectors of disease and so forth. I mean, I think it's really going to take a very sophisticated, you know, confluence of efforts to fight something like that.
Yeah, and just to our audience, we will be doing some webinars very soon on how journalists can fight disinformation around the pandemic. And one of those will be with an Indian journalist, a health journalist, and he will be also be able to obviously talk about the Indian context, because we've had a lot of questions about what's going on in India right now. Unfortunately, we're going to have to stop there. We're about out of time, but wasn't able to get to all of your questions, but what wonderful questions you had. We really appreciate the engagement that all of you are bringing to this conversation. I want to thank our two panelists, first of all. Incredibly useful conversation. I learned a lot. I'm sure all of our audience did as well. Sarah Pierce and Natalia Banulescu-Bogdan, thank you so much for being with us. And as we said, we'll make your contact information available to people if they have more follow-up questions for you and your colleagues at the Migration Policy Institute. I do want to also let others, all of you who are watching, know about some of the webinars that we've got coming up. This week, tomorrow, we're going to be talking with Dr. Angela Rasmussen, a virologist at Columbia University, and she is an expert that's being quoted in media all over the United States, including frequently in the New York Times. So that's going to be a real valuable discussion. On Wednesday, we're going to have a Spanish language webinar with Dr. Gabriela Minaya on clinical investigations going on right now around the virus and what we can expect from them. On Friday, we're have a really interesting panel discussion with newsroom leaders Maria Ressa in the Philippines, Branko Brkic in South Africa, and Ritu Kapoor in India. And we'll be talking about how their newsrooms are covering the crisis and what lessons we can learn from them. I also want to remind everyone that we'll be putting up the recording from this session, so if you missed some of it, you'll be able to see the whole thing. We'll also be putting up a summary of the main points that have been made in this discussion. So again, Sarah, Natalia, thank you so much for being with us, and thank you to all of you for participating, and we'll be seeing you again in more webinars to come. Thanks very much.
Thank you.